Welcome to another edition of From the Source. I'm Elizabeth Johnson. Today my guest is the man who saved a young girl from dying with a heart issue and wound up changing the lives of many children throughout the world. Robbie Donno had joined the local Rotary Club in 1971. In '75, he took the reins and became president of the Manhasset Rotary Club. His life changed and changed the lives of many young children. Thanks for joining me today, Robbie. It's so good to have you here today.
Well, thank you for having me.
Yeah, it's always a pleasure. I want to know a little bit more about how the Gift of Life started. I understand that you had joined the Rotary in 1971, and you were just a member, and you, I guess, really gravitated towards the club as well as rising to president.
The Rotary journey wasn't quite as smooth as that. My father had been a member of the Rotary Club early on, and when I was as early as 14, he would take me to the Rotary meetings.
Oh.
And they used to have them at Lorraine Murphy's, if you remember Lorraine Murphy's in Manhasset. And
right across the street from Lord and Taylor.
Right across the street from Lord and Taylor. So he would take me, and as was his way, he would, with my sisters and I, when he wanted to talk to us about something, we'd take a ride in a car. And after the meetings, he had me as a captive audience. He says, when you grow up and you get in a business, you'll earn your money, but you have to give something back to the community. And of course, every year, once a year, we'd go to these meetings, and I'd be with these old guys, and he would give me the same lecture every year. And like any 15, 16, 17-year-old, it's in one year and out the other. When I graduated from college, I got married, did my Army duty, and we came back, and I went into business with my father. I only got to work with him 3 months, and he had cancer, and he passed away 9 months later. And his friends, the people that I had met, well, during those years, from the time I was like 14, some of his friends invited me to become a member. I joined to keep my finger on the pulse of the business community, because there were a number of people, bankers, lawyers, whatnot, professional people. So the motivation was not altruistic. Once I got in there, however, they were doing things that I thought were pretty nice, things in the community. And I joined in. I became involved with it, and I liked what they were doing. As time went on, I recognized, I had read an article in the Rotarian magazine about a girl who had been attacked by a hyena. She needed plastic surgery. I used to sit next to a doctor who was originally in the Rotary Club of Palermo, Sicily, and was a plastic surgeon. He was also an archaeologist, had done diggings with King Gustav of Sweden, founded museums. He was written 8 or 10 books, and I actually used to leave work a little bit early to make sure I had a seat next to him in the Rotary meeting. And I took this magazine article and I put it on the table, and basically said, "Hey, doc, is there something that we can do for this kid?" And he started orchestrating me. You have to get me medical records and whatnot. So I now pursued the Rotary Club in Kampala, who was advocating for this girl. They had taken care of her for 10 years. And as the story was written, she was so horrible to look at that she used to have to wear a burlap bag over her head, and they cut, holes for the eyes and the nose and the mouth. But she wanted to give back for all the kindnesses and care that these men had given her. He passed away suddenly, so I lost the contacts with his doctors. And there was a new member of the club who was the vice president of development at St. Francis Hospital. The name was Frank Rignanti. And as a young person, I'm lost. Now I don't have the doctor, and the guidance. And I'm reporting to the club, and Frank calls me over. He says, "What are you trying to do?" And I tell him. And he writes on a piece of paper. He goes, "You do this." He rips it in half. "You do this, and I'll do that, and we'll get this kid over here." Now, if you stop and look at moments in your lifeline that are pivotal moments. These are pivotal moments because what he didn't say was, oh my God, you know what it's going to take? He had St. Francis Hospital behind him, the doctors, and we finally put a whole proposal together to take care of Margaret Rose, was her name. It took 2 months to get a return letter every time we did correspondences from Uganda. It wasn't like we could text. Times have changed. Instant communication. We had a family for her to live with and whatnot, and I got the letter back from the Kampala Rotary Club thanking me profusely for the efforts that we had put in. A doctor had shown up from Australia, a Rotarian from Toronto, Australia, doing cleft palates as part of a Rotary project. They took him to see Margaret Rose, and on site, he took her back to Australia, where she had to go through 40-some-odd surgical procedures.
Oh, my.
In that package, they said, since you have a heart center involved in your program, we have children suffering from congenital heart defects. Would you consider one of them? And they sent the medical records of Grace Aguero. By that time, I was president of the club, and she came here in October, I can tell you the date, October 28th, 1975, and was operated on a few weeks later. But Frank was really the brains behind getting her here and was my guide, and he is now at 90 years old, still my mentor, 45 years later. So he's absolutely a great man. So it was he and I in those early years that were what I call ham and egging, starting to bring children in. Grace was operated on, then there was a second one, then there was a third one. And that was through the Manhasset Rotary Club and the Kampala Rotary Club in Uganda. That's how the birth of the Gift of Life came about.
So, one step backward, talk a little bit more about Rotary and how impactful it is throughout the world, because how many clubs are out there?
There are more than 34,000 Rotary clubs in 200 countries. There are 1.2 million Rotarians. Part of that network is also what we call Rotary clubs for college-age students to age 30. There's probably, I'm going to guess, somewhere around 250,000 what they call Rotaract. Then there's a high school version of Rotary, and they're very much involved in our program, the Manhasset Interact at Manhasset High School. There are 450,000 to 500,000 Interact clubs. So there's almost 2 million people worldwide involved in Rotary doing all kinds of things. For instance, the biggest example is the polio eradication program was started by Rotary in the Philippines with a conversation that was very much like the conversation I had with Dr. Caltagirone, the plastic surgeon, over lunch. And a guy came, his name is Benny Santos, who's a doctor, came up with the idea of eradicating polio in the Philippines. And that grew, their efforts in the Philippines to distribute polio vaccine and take care of it was the birth of a program that now was managed by Rotary, the World Health Organization, UNICEF, the Bill Gates Foundation, all came behind Rotary. And the local Rotarians, we're cheap labor, we work for nothing. We're volunteers, are the ones who distribute the vaccines and make sure it gets to people, and do the public education programs, contact our local governments because the Rotarians have access. So it's this great big network that's out there, and that has become the platform for Gift of Life. It's the same platform. So they'll do all kinds of things. They do have programs for the eyes, AIDS water projects, all kinds of things, including local projects in our community, turkey baskets at Thanksgiving for impoverished people, food programs for veterans, all those kinds of things.
Amazing. Now, you also I gained the attention of the president's wife, specifically, I remember in Manhasset, Ronald Reagan's wife came here to St. Francis.
Yes.
And how did that come about?
One of the members of the Gift of Life, we formed a separate board. It grew through Rotary, and then we wanted to bring on other Rotary clubs. And in order to have buy-in, there had to be members on the Gift of Life board. We made it a 501c3. That would be a concentrated effort. One of those members was a guy by the name of Murray Seco, who was with the Flushing Rotary Club. And he understood we were sending a medical the team from St. Francis to screen children in Korea. Our medical mission coincided with President Reagan's visit to Korea. Okay. So Murray says, the president should, visit us in Korea because we're doing good things and show the people-to-people nature of this, our efforts, and, And I looked at Murray and I said, are you out of your mind? The president isn't going to do that. We're doing great stuff, but let's... But anyhow, we sent the package to the president through Gary Ackerman, who's a congressman from Flushing, because we had contacts. Gary was always helpful to us. And we also, there was an approach made by the State Department through Korea, because the Rotarian involved in Korea, his wife had been doing this. He was the civilian liaison officer coordinating between the American Armed Forces and the Korean Armed Forces. So oddly enough, all of a sudden, we get a call from Mrs. Reagan's staff that they're interested, and she wanted to meet the kids. And the next thing I know, the two children are on the plane, and all of this was orchestrated really through Frank Rignanti's office. He was coordinating all of this, and that's where we got the call, was at St. Francis Hospital. And as Frank tells the story, he picks up the phone, this is the White House, we'd like to meet with you, this is a Friday night. And Frank says, fine, when? And he said, tomorrow morning at 10 o'clock. Okay. And the next thing you know, we put things in motion. Sheila Tate was Nancy Reagan's press secretary, recently wrote a book called The Lady in Red. And we're in The Lady in Red. And she talked to me about those, and I was telling her about the fact that I didn't think the president, we got a nice letter from the president's office saying that his itinerary was full. But then we got a call from Mrs. Reagan's office. And Sheila Tate says, you have no idea how many times we changed the president's itinerary because he wanted to meet you. We just couldn't make it work. And that's how it got transferred to Mrs. Reagan. Mrs. Reagan fell in love with the kids. Yes. And the experiences with her, for me, was, an eye-opener. Very kind, generous person. When I met her at St. Francis Hospital, she flopped on the floor. I ended up in a room. I ended up in a room with her by myself and one of the sisters from St. Francis, because I'm the founder, and wanted to have a conversation, a private conversation. We'd done the press conference, but she flops on the floor and she's rolling around the floor with these kids, and my mouth dropped. And I said to her PR guy, I said, how come we don't see this on television? And he said, let me ask you, if I put this on television tonight, would you have believed it? But the kids loved her. She was tickled. She was like everybody's grandmother. She was really great with the kids. So for me, it was a great experience. And she couldn't have been more helpful to us.
Now, you started this in '75, and in 2003, it became Gift of Life International. How come it took 25 years to make it a nonprofit? Is it because of all the technicalities related to the...
Actually, it's not the technicalities. It's a matter of timing and having everybody's mindset, getting to a point where everybody understands that this is a necessity. when Mrs. Reagan got involved, we did a program called Flight for Life, where we sent packages out to Rotary clubs all over the country, and actually raised seed money for them to start their own programs, autonomous from us. So there's a program in our Rotary district in Suffolk County and 5 different areas by Rotary districts in New Jersey, and then it spread, throughout the world. Mrs. Reagan gave us a global image, and now everybody said, we want to do that too. So we had to answer that. But everybody was proud of their program.
Right.
And so now, and the truth of the matter is that they look at us as, as this big brother, and we're going to take over their program. We formed Gift of Life International to tell the collective story of what all these independent programs had been doing, and then to coordinate them into focused efforts. And in 2009, we actually hired our first staff person. We only have 3 now. And we're going to do 3,500 surgeries this year, among other things. There are other things that are going on, but 3,500 open hearts this year. And the idea is to develop the capabilities of doing those programs, to being able to operate, empowering people to operate in their own country. Dr. Balboni, their first cardiologist at St. Francis Hospital, told me that that was the direction we should go in with the first or second child. But everybody liked bringing the kids here. The hospitals were doing it because they liked hugging the kids and going through the drama with the mothers. Now, with the stress on the healthcare system here and the financing, it's a lot more effective, less expensive to operate on the children there. So Rob Railman, the executive director, who will be president of the Manhasset Rotary Club starting in July 1st, is the executive director, and we put together what we call our Hearts Are In program, and we started with Uganda to develop the capabilities in Uganda. And basically, we need government assistance, so the government has to have a buy-in. The hospital has to make it a priority because there's politics in the hospital. The spine people want the money, the eye people want the money, the kidney people, everybody, each of the specialties would like to develop their program. You have to put the assets to it and have a commitment on the part of the hospital to do that in an area with fixed revenue. Then we get the Rotary clubs involved in those countries to support it because they want to help it. And we start another NGO in those countries to support that program. So it's a 4-legged stool in order to develop the program. I just came back from Uganda. Last year they did 223 procedures. They didn't have a fatality. They're a first world cardiac team. We had a meeting with the Prime Minister, and basically we're updating him on the progress of the program and what we needed at the hospital for them to help. And he couldn't be more accommodating. But this is a success story. El Salvador is a success story. We started that in 2009, 2010 also in the development. And they're doing 250 surgeries. Actually, in El Salvador, the incidence of mortality for congenital heart defects has dropped by 50% since we're there.
Amazing.
So their population is smaller. So the 250 in El Salvador as compared to Uganda has more of an impact because they have a smaller population, but it goes to show you how you can change. And they're empowered. Their nurses are empowered. And it was our doctors. We would send 4 teams a year there to work with them one-on-one. And the change in them is amazing. Even as people, it's almost like they're more upright. They are proud of their accomplishments. So while you're working on the heart in a child, you're working on the hearts of everybody else around them because now they get to help their own children. That's part of the gift.
Now, these doctors that go to the location, who pays for their transportation there?
Gift of Life pays for their transportation, you know, and all their accommodations while they're there.
Right.
And comically, I said to one of the doctors, you know, you're going on your vacation, using your vacation time to do what you do for a living. He says, no, no, no. He says, to a person, this is not what we do for a living. The pressures of all the bureaucracy that they have to go through here is very different. All they do is operate on the children. We set them up and they operate all day long. And this is, he said, this is why I became a doctor, is to help people. And that's generally, you know, it's not to do the paperwork and, you know, worry about being sued or, you know, it's a completely different dynamic. And the people there are, in these other countries don't have access. It's a miracle to them. Right. So they're very grateful for any chance that their child may have.
Now, on the part of the families, like let's take Uganda, how are they sourced? I mean, how do people know about this opportunity to save their children?
Well, it's highly publicized in these countries.
Okay.
You know, a child goes into, you know, one of the hospitals here, it's another day at work.
Right.
Goes into a hospital there, and it's all over the place. I mean, and when, in particular in the beginning. So it becomes pretty well known, and now we do outreaches. One of the components, we're asking for another grant from Rotary International from the foundation, a stepped-up program for El Salvador, so that we can get diagnostic vans that can do diagnostics out in the field. Mm-hmm. So that we are going into communities screening more children so that they'll have that advantage. It's still, in many of the places that we're going, it's the parent who works the hardest to save their child that gets the help. Nice. And that's the reality of emerging countries. They're not, the parents are not sophisticated. They're scared, intimidated. They don't think it's possible. Once you give them that hope and they know that it exists, then they'll seek it. So a part of it is getting out into those communities, and that's where the Rotary is very effective, because they let their own people know. Having that platform of Rotary is incredible. The Rotary Foundation will raise money. If we raise $150,000 to do 60 children or 80 children in this country, Rotary Foundation, because we're partnered with the Rotary clubs there, will match that 50 cents on a dollar.
Oh, that's
so that's how we are leveraging it. And when you talk about an effective management, you have the in-kind contributions of the doctors, and you have leveraged money. So, you know, I would say that for every dollar we raise, we get something like $15 or $20 in services. So if you donate $100, I'm getting, it's like getting $2,000.
Right.
So the significance is the leveraging of the services into effective service to the children and care.
So how do you bring in the young people from, let's say, the high schools, like from the Interact Club? What do they do in this process?
The Interact Club actually raises money to save a child's life. So they are, the Interact Club has a teacher, and in the case of Manhasset, it's Christina Barrera, fabulous teacher. That'll go to, she speaks to the idea that you can't pay a good teacher enough. I mean, her impact on the children is phenomenal. Great person. And the kids love her. And so she organizes the students. They will do wrapping at Christmas time at Lord & Taylor's for money. They sell pizza. They made a deal with Villa Milano. So you know, he delivers pies there, and within 10 minutes the pies are gone, and they mark up what he charges them, and he gives them room. So they do, they'll get bracelets, they'll sell Valentine wishes or candy, things like that to raise money and involve the school in their fundraising programs. And they do other things as well. They're helping the soldiers. They do food collection drives. They do other things besides that. When it's time, last year, we actually did a Skype call with the child that was coming in from Kosovo. Happened to be in the house. We arranged it so he was in the house of a child that we had operated on 2 years ago that the Interact Club had sponsored. So we did the call to reunite the students with somebody who was operated on 2 years ago. And the father and the daughter that were coming here, Annette, came here, got to see who was going to greet them. Now, when you think about that, that puts people at ease because they're coming to a strange country. They don't speak the language. Right. They're in a stressed situation to begin with. And now they see a family of people that is going to greet them, even if they're teenagers. The teenagers, Dr. Lovechuck is the one who does the surgeries for us at procedures at St. Francis, is fabulous. Right. So he actually has some of them at times come into the operating room so he can show them what they're doing. If there was a time that I wish I had a camera, it was after that because the students were walking 3 feet off the ground. And he's a great mentor of those students. And that made an impact on them, watching the life-saving procedures that went on this little girl, and now they'll be able to keep up with this girl. It's time to do another Skype call just to catch up to see how she's doing and the other children. When I was going to Kosovo, unfortunately in today's climate we couldn't make that trip. It'll happen another time. We were going to put a reunion together between the kids that had been operated on there that had been sponsored by Interact and the Interact. So it's a great process for children to learn. Teachers will teach about the heart. They'll teach about geography. The kids are learning about profit and loss because whatever programs they're doing has to do that. That's part of the deal. But they're learning that they have the power to change the world. And of course, when you sit there with somebody like myself and I talk about some of the children that we started with, Interact sponsored the second child, Rabina, who works for the cardiologist at the Uganda Heart Institute. And this last trip, I met Rabina's grandson.
Wow.
And
that's amazing.
Yeah, you didn't think of that.
So you can see the impact.
You see the impact, so it's not only saving the life, you're extending generations that'll exist far beyond your own lifespan. And you watch the joy, the moments that Rabina has with her grandson, with her son, with the people around her. When I visited her, all the people that she worked with came up and thanked me for saving her life because she's such a delightful person. 40 years later, they're still thanking me for who she is. So now you see these as separate gifts. I actually think we ought to change the name of the organization to Gifts of Life because it's all those moments during the lifetime that's been saved that if we hadn't intervened, you could erase them. And life would go on, but it wouldn't be as joyful as it is with those people in it. So brothers and sisters wouldn't grow up together. Grace ushered her mother from this life to the next. Her mother had a prolonged illness. And Grace, the first child, was able to stay with her mother. She had cancer and eventually passed away, but she was there at her bedside. That's a gift. That was the gift returned to her mother. If we hadn't saved her life, that would have been gone. Those moments that are so special to people would be gone. So it's many gifts. The gift giving life is the sequence that starts all the other gifts that follows, all the birthdays, dance recitals, graduations, marriages, children, grandchildren, all of those things is encompassed in that procedure that takes place in an operating room with people who are I ignorantly call plumbing work, who connecting the pipes so that child can live on.
Well, it's a gift to have you on my show. Thank you so much, and I hope that you will come back.
Anytime. Thank you. Thank you very much for having me.
That's all we have for now. Tune in next time for more in-depth interviews with members from your community.